of hospitals. In Chiromo group of hospitals. She's currently working there. Previously, she was working with the Madari National and Teaching Referral Hospital, as well as Kenyatta National Hospital. So today, let's talk about the most abused substance. And thank you all for joining today and being with us here. And even for those who are new, you are all much welcome. And let's talk about this situation that we have that is affecting our health, that is making us smile all along. But at the end of the day, it has positive and negative impacts in our life. So Caroline, welcome, and let us hear from you. For our audience, on the Q&A section, you are able to put your questions there, your comments, any clarity that you want, and even on the chat section, and Dr. will be able to respond to us. So thank you all. Caroline, you can take over.
Good morning, everybody. I hope you can hear me. Thank you for that lovely introduction, Justus. As he aptly introduced me, my name is Dr. Vundi. I'm a psychiatrist at the Chiromo Hospital Group. And I'm very, very passionate about advocacy, and especially about educating people about mental health and wellness. And this is because there's a huge gap between people having mental illnesses and mental challenges and them being able to know what to do about it. So people are noticing that something is not okay with me or somebody that I know, but they don't know, who do I go to? Do I go to a psychiatrist, psychologist, etc.? And that's part of why we are doing such talks, so that we can bridge this gap. Today, our topic is on addiction, and I'll be projecting my screen shortly because I have prepared a presentation on the same. Okay. And I want us to look at addiction from a very different angle about how we've always talked about it. We've always talked about addiction as the symptoms or as the end result, this person needs to go to rehab. But today we'll kind of uncover and see what are the causes of addiction, especially alcoholism. What gets somebody to this point, basically. And to start us off, I would just like to show the Chiromo Hospital facilities. We have 4 branches in Nairobi and 1 in Nyali, Mombasa. Right, so we'll just jump right in and look at the different substance-related and addictive disorders.
Doc, a minute. Some of us want to see your face. We'd want to see your lovely face.
So I don't know if I can show my face and the screen at the same time. Let me try.
You can put on your video.
So it says that the host has stopped the video. So I think it's something you need to do on your end. Yeah, I'm trying, and it says that the host has stopped the video.
You proceed, then we'll be able to share maybe your image later. Thanks.
Okay. All right. So we had just started talking about the different substances. And I'd like to say that alcohol is one of the commonest substances that is being abused, as well as the one you can see right at the bottom there, coffee. And another one that is up there right in the middle, tobacco. So alcohol, tobacco, coffee are the commonest abused substances. And when I say commonness, this is across the board, males and females alike. When we move to more hard substances, we are talking about cannabis and opioids. Opioids are things like heroin, morphine, pethidine. When we move to those harder drugs and even cocaine, these ones are more frequently abused by males. But this is not to say that females do not abuse these substances. It's just that the males are more predisposed to abusing such. Of note is that in that list, cannabis and tobacco are known as gateway drugs. And this means that usually it's very unlikely you'll find somebody just using cocaine, without having used cannabis and tobacco. So cannabis and tobacco are the ones that lead or somehow open the gate to using harder drugs. So this is to say that we take cannabis and tobacco use very, very seriously because we don't know where it could lead to. We don't know if in 5-10 years, we will be dealing with an opioid addiction. Moving on, we wanted to go a little bit deeper and discuss how these substances end up becoming a problem in the first place. Now, I want us to look at this picture. We can all see what's happening, right? And this is a very, very common analogy. This man is burying his head in the sand, all right? And the statement up there we are seeing is that denying addictive behavior in the society is like burying our heads in the sand. So I'd like us to just reflect on that. We cannot ignore the problem that is right in front of us. So let's start with the basic science. How does somebody develop an addiction? How does somebody develop an addiction? I'll try just one more time to, the video still is not working. I think it's something on your end, but I'll continue. So what's the basic science underpinning addiction? So in every human being, we have a brain reward system. The brain reward system is facilitated by a chemical called dopamine. I know we've all heard about dopamine, right? It's one of the neurochemicals in our brain that is in charge of reward. Okay, so what exactly is this reward system? In fact, I'd like us to ask ourselves a question. Why do we do the things that we do? Forget even drugs. Let's go back to a bit basic things. Why do we sleep? Why do we eat food? Why do you go on social media? Okay, this is because of the reward system. So there are different nerves in the brain that communicate using dopamine, all right? So what usually happens is that when you do something like going on Facebook, right, and it gives you a particular satisfaction, the neurons get excited and release a lot of dopamine. So it's not that the reward itself, it's not the reward itself we chase, it's even actually the expectation of a reward that's more powerful. So it's actually you expecting to go on that Facebook that increases the dopamine level. So if a reward is greater than what is anticipated, then the dopamine increases, all right? And this pleasure underpins very, very many things, but most oftenly addiction. So you find that every time you use a drug, for example, you will want more and more because at some point the dopamine levels get higher and higher. So you'll keep wanting more and more. So there is something actually that we will talk about called the dopamine fast, where we are advising people to take fasts, even from things like social media, high dopamine reward activities, right? you need to be doing a bit of dopamine fast, because this is how you end up being addicted to things. We'll talk about a bit about that in the end. So let's move on. Let's move on to the next slide, where basically we want to talk about the stages of addiction, because somebody does not just wake up one day and end up to the point where they are addicted. So with drugs, it's it usually begins with a stage of experimentation. And all human beings have gone there. Even I will be lying if I have not said that I've experimented with alcohol, because I do drink a glass of wine here and there, right? So what we say in science is that most people have experimented with something, even if it is coffee, right? And if you haven't, then you're on the right path. Okay, so experimentation is at that point where you really don't need this thing, but you've tried it, it's a non-issue, and it's okay, you're in control of it, right? So that is the experimentation phase. Now, usually the problem with experimentation comes in, for example, in young people where it's driven by peer pressure. So if somebody is experimenting, say a young boy is in Form 1 and he has joined Form 1 and people are smoking bang, and he feels he must do it to fit in, that one will be problematic because he's doing it to catch up. And it's problematic because whatever his peers decide they want to do next, he will do it. So if his peers decide they want to skip school to smoke cannabis, then he will do it. So then it starts becoming a problem, because now it's not just experimentation, which takes me to the second point of social. This social stage, I would actually not even call it a stage of addiction. I would say that sometimes people do things because of the setting they are in. We've had the saying, when you're in Rome, you do what Romans do. So if I come to your house and you offer me coffee, you know, I might feel, let me drink this coffee because that's what people do. I have seen some patients who say, I only smoke when I, go to the bar over the weekend, but you'll never catch me buying cigarettes during the week. All right. So this one now is the social use of substances. Then now we have the instrumental. We all know what an instrument is. An instrument is a tool, something that helps you do something, right? So this stage is a bit tricky because it means you now have started needing this substance. You need it. So there are people who say, without my morning cup of coffee, don't talk to me, I'm a horrible person. Now you need it to function. Some people say, by Friday 5 p.m., your taste buds are already tingling for that beer. This is now instrumental. So you really need it either to relax, not necessarily to function, but you need it for something, right? There are people who, when they're having dinner, they must have a glass of wine, like the Spanish people, even the Italians. So you need it for something. It's not yet an addiction, but you need it for something, okay? It's doing something for you. Now we have habitual. Habitual is now the fact that it's a habit. It's a habit. It's become something that is part of your routine that you cannot leave out. There are some people who say that before I go home after work, I must pass by somewhere. I must. That word must? I have to. There is this habit now that you have formed. And the thing about habits is that when you don't do it, then it creates some kind of tension. So if somebody, let's say your habit is every day after work, you must pass by your local bar. Let's say that particular day, your child gets sick and you're called into the hospital. You find that you're almost irritated and agitated that you cannot do your usual evening drink. Yeah. You find sometimes even you're almost saying, I really don't want to go to the hospital to see my child who is sick. I'd rather pass by the bar first, then I'll go see my child, kind of thing. So now that one is getting to the point of being quite serious. The habitual stage is getting quite serious. And then we go to compulsive or the dependent phase. This one is now you are in too deep. And a compulsion is something that you do because your body is asking you to do it or your mind is asking you to do it. We have a condition in psychiatry called Obsessive Compulsive Disorder, OCD, where you find some people, for example, I had a patient who would wash his hands five specific times when he touches anything unclean, and it has to be 5 times. Of course, he doesn't want to do it, but he has a compulsion. So compulsive drinking, this one is by force. So the previous example I had given, whereby somebody has left work and he usually passes by his local, the child is sick, is in hospital, this person will feel, I actually can't, I just must go. Compulsive drinking will make you miss work. Compulsive drinking will make you drive even when you're drunk. So because you're compelled to do it, you're dependent. And at this point, you can even start experiencing withdrawal symptoms if you don't use this substance. So what does addiction look like? I think by the time we are at this point of the conversation, everybody has in mind somebody they know who has been addicted to something. So let's have that mental picture even as we discuss this slide, because the face of addiction is very visible. It's never a silent battle. Something like depression, for example, allow me to digress. Somebody can be depressed and you can almost maybe not see it, right? Unless it's a very, very severe depression. Somebody can have anxiety and you may not be able to pick it up. But when addiction is severe, especially when you're in stage 5, the dependent or compulsive drinking, you will always be able to know, even externally. So what does this look like? Number one, this person will use a larger amount than one intended to. So say, for example, you are out socially having, let's say it's a wedding, or, you are just celebrating something with a group of friends, and you notice somebody who is just drinking faster than the others, faster than the others. Or another way to tell is somebody who always shows up to events already drunk or already having drunk, because the societal norm is, even if we are socially drinking, people meet and then you start because you're socializing. But sometimes you find somebody coming and they're already, staggering and slurring, and they still continue to drink. So this part of using larger amounts externally, you can also see it. Number 2, there is a persistent desire to stop or cut down with multiple failures. So with alcohol addiction, this person, in fact, will have tried once or twice. And a common scenario is this. You'll find in social settings, somebody who's struggling with addiction will, at the beginning of a social meetup, will say things like, I'm not drinking tonight, and will verbalize something like that. But somewhere along the line, they will start ordering alcohol. So you can see at the beginning, this person had every intention not to drink, but somewhere along the line, they start drinking. So a desire to stop with a failure is a sign of alcohol addiction. Number 3, spending much time in search of the substance. People who use substances always become, the substances get to the point where they start running the show, especially when we are at the point of addiction. That's what they talk about it. That's what they talk about most of the time. They spend a lot of time looking for it. They spend a lot of time talking about it. Their stories revolve around, that one time we were smoking this, and that one time we were, their life starts revolving around the substance. All right. And that's the last point. All daily activities revolve around the substance or the use. That is the face of addiction. Now, moving on, let's discuss what causes this, because I always say this, even to families of somebody who is an addict, I tell them, Nobody wakes up deciding that I actually want to be an addict, right? There are so many things, many etiological factors, many layers to addiction. I'd like you to imagine an onion. You know how an onion has very, very many layers, right? That's how addicts are. So usually in society, we always see the addict, the whole onion. But research has shown that addiction has got very, very, very many layers. And the first layer is easy access and availability of drugs. And for those of us who are parents and listening into this conversation, I want us to be very, very alert, because the society right now is not the society it was 10, 15 years ago. I remember growing up, weed was this very big thing. I mean, it would be very difficult to even imagine where can you get this thing. Nowadays, it's very easy to score some cocaine. Nowadays, children in university are abusing a lot of cocaine and a lot of ecstasy, the Mdma. I don't think I mentioned that in the classification. But Mdma is another strong, popular drug that we are seeing now. It comes in the form of a pill. Okay, it comes in the form of a pill. So you can't smell it the way that, you know, alcohol or weed, you can smell somebody who has used it. You cannot smell it. So children are using a lot of these new substances, okay? They are using a lot of cocaine. And when I talk about access and availability, let's also think about how much money we are giving these children. Because, you know, fortunately or unfortunately, a lot of us have worked hard to get to where we are. And we want to give the children, our children, a better life than we had. But I think to some extent, we really need to curtail how much money we are giving these children, because an excess of money is now giving them a lot of access, them to be able to buy this cocaine and to be able to buy this molly and all these other substances. All right, so parents, that's just a take home for you. Point number 2 touches on the almost the first point that we talked about, social acceptability of alcohol, tobacco, and mirror. This point is, it has become normal. Alcohol is normal. Tobacco is normal. And the thing is, we are also keeping it in our homes, right? Because it's normal. It's that thing you serve your guests when they come over for a drink, for dinner. You serve them a glass of wine, you give them a beer. And I'm not here scolding you people, but I want us to know that these are some of the things that contribute to alcoholism and some substance use, right? Number 3, a highly young and dynamic population, which we really can't do anything about. Next, we have curiosity, thrill, and myths around drugs and substance abuse. The hype, you know, the hype around smoking a cigarette, the hype around drinking also contributes to substance use. Peer pressure, breakdown of social norms and belief system. Again, for peer pressure, there's also not so much we can do, but I'd like to say that for young people, it's always good to enforce the self-esteem of a child so that they know who they are. So that they know who they are, even by the time they are going to a new society, they are not pressurized into doing new things. When I talk about this point, I think about some patients that I have managed who, you know, finished their high school education, did very well, ended up studying in the UK or in Australia or in the States, but mostly the UK and the States. And we're seeing these children go there, and it's like they kind of forget who they are. And then they start doing some of these things that people out there are doing. Now, I'm not blaming the Americans or the UK people. I'm saying that a child who has grown up here, very shielded, and then is plucked and put into a different society, and everybody out there is doing ecstasy and cocaine, that child is at a very high risk of picking up these substances. Early exposure of drugs to children and poor parental guidance. I would like to urge anybody who keeps alcohol in the house, you know, of course, keep it under lock and key. You as a parent shouldn't be getting extremely drunk in front of your children, because guess what? You are showing them that is the normal thing. So, I mean, if you are to drink, for example, you as a parent need to do responsible drinking and showing them that you don't need to do it every weekend, or you don't have to do it to the point where you're blacking out and vomiting and all that. So there is room to expose children to safe and responsible drinking, but I would suggest that, to help them see that you can guide them through some of these things. But of course, I'm not talking about exposure to cocaine, because if as a parent you're doing cocaine, then that's problematic, So I'm talking about the socially acceptable substances, the alcohol specifically. We need to, even if you're going to expose them to your children, it needs to be extremely regulated, still locked. We have some children who come and tell us that I usually get alcohol from my dad's cabinet, and then I drink it, and then I put some water in it, and he'll never know. So we need to be very, very careful as parents as to what we are doing. All right. Experimentation is the next point. Escapism, belief that drugs solve problems. And lastly, hidden psychological disorders. That's where I want us to dwell, because for me, this is the biggest cause of substance abuse. Most of the time when we have an addict, after long investigation, we'll find that there is something happening with this person. Either there is low self-esteem, either there's depression, bipolar. You might even find that this person was abused at some point in their life, So there will always be some underlying psychological disorder. And that's why I want to say this point. And if you don't take anything from my presentation, please take this. Throwing an addict in rehab is not enough. It's very, very important to start the process with a psychiatrist so that we can be able to assess whether there's a hidden disorder. Because if you just throw somebody in rehab for 3 months, eventually they'll come out. They'll come out of rehab. And if there is bipolar, it will continue. If there is depression, it will continue. So we have to get that underlying condition very, very early and treat it. So signs and symptoms of drug abuse. I'm almost coming to the point where we'll have our Q&A. I can see the questions are building. So we'll address that shortly. So signs and symptoms of drug abuse. I mean, I had said earlier that even as I'm giving this talk, somebody comes to mind. We have all known an addict at one point in our lives, either a family friend, a neighbor, somebody at work, or maybe it's even you, right? The signs are always there, and they are physical and behavioral signs. So sudden mood swings, changes in normal behavior. For example, if somebody used to come to work on time, nowadays they're always late, or they even miss work. Lack of hygiene and grooming. And especially this is when it's sudden, somebody used to look very okay. And I'm not talking about being stylish. I just mean basic hygiene. Somebody is having a bit of a smell at the workplace, those kind of things, those points that there could be an issue. Withdrawal from friends and family. You find this person doesn't want to come to family gatherings anymore. Or instead of even withdrawing from friends, you can find addicts just suddenly they come up with new friends. And this is another common tip for parents. If you just see your child with new friends, people they never used to interact with, just out of the blue. And of course, you can tell people of suspicious character. You see that these new friends just look a bit off. That one is a telltale sign. So please make a point of getting to know who your children's friends are. Get to know them. All right. Then loss of interest in normal social activities and hobbies. So the things people normally do, this person doesn't even want to do them. Changes in sleeping patterns. So for most substances, you can find there is an issue with insomnia or hypersomnia. So not being able to sleep or sleeping too much. And this is where problems with lateness, coming to work late, come in, or missing work. Okay. Bloodshot or glassy eyes. Constant sniffles or runny nose are a common pointer of cocaine use. All right. So these are just some, but I usually say this when it comes to signs and symptoms of drug abuse, the biggest sign is your gut feeling. And I believe we were given our gut feeling just to know that something is off. So even if you don't see these specific changes, there's always something that will tell you this person is not okay. Trust your gut. Trust your gut. All right. I mean, this slide really was just a bit of a filler. There are different types of alcohol, but I think the main classification for us is the licit and the illicit brews. So usually people will start off with the ones that we know, the liquors, the wine, the beer, before they end up getting to the illicit kind of brew. I want to skip this slide a little bit, but basically this slide was talking about the different things that can happen when somebody abuses alcohol, but we all know them, you know. When somebody is extremely intoxicated with alcohol, it can cause motor incoordination, right? Where you find you are not even able to do simple things like put on a condom. So this is where people get at risk of even getting this kind of infections. You find they get tremors, their hands are shaking. It impairs judgment. You find people now are driving, drunk driving, people get irritable. Basically, alcohol is a danger according to this slide, right? But the last point is the one I want us to focus on, because alcohol actually has an effect on the brain. When we do radio imaging studies of people who've been drinking for quite some time, we find that the brain has significantly reduced in terms of size, what we call brain atrophy. So actually alcohol can kill, and the way that it does this is it can cause you to become sedated, you're not able to respond, you can get respiratory failure and even death. So heavy alcohol use is not something that we take seriously. But before we get to the point of death, you know, there are things that point towards heavy alcohol use, what we call specifically alcohol withdrawal. So alcohol gets to the point where it becomes a little bit dangerous, because actually not a little bit dangerous, but a lot dangerous when it produces this withdrawal. For somebody who's been drinking every single day for a long period of time, the body starts to demand for alcohol so that it can function. Usually withdrawal usually starts 6 to 12 hours after the last drink. Usually it starts with some hyperactivity of the autonomic nervous system, whereby there is sweating. It can cause low or high blood pressure, tremors or shaking of the hands, and being unable to sleep, nausea and vomiting. And sometimes they will vomit that point of bile where they vomit the green stuff, meaning the stomach is completely empty, but they're still vomiting. Sometimes they will get hallucinations whereby you experience something that's not there. So you can hear voices, but most of the times an alcoholic will tell you, I feel like things are crawling on my hands. So those are called tactile hallucinations or touch hallucinations. Psychomotor agitation, this is where the person is just restless. They can just be pacing up and down, you know, cannot just relax. Then we have anxiety, and the most serious alcohol withdrawal sign is seizures. So at this point, alcohol withdrawal seizures, this is an emergency and it requires admission to hospital. So I wanted to touch a bit on nicotine, in as much as we had wanted mostly to focus on alcohol. But I mean, I know we've all seen this picture somewhere. This is one picture that comes up even in advertisements. I think some people even put it on the cover of cigarette packs nowadays. But what I want to tell you is cigarettes affect every single system. Every system, nervous system, that's the brain, cardiovascular system, that's the heart and lungs, digestive system, that's the stomach and the intestines, endocrine system, that's the pancreas and the reproductive system. Basically, think of any system, it affects that system. And on top of all that, it increases, I think there should be around 12 cancers, if I'm not wrong, 12 types of cancer. We have cancer risk in the mouth, the throat, the lung, skin cancers. Smoking causes actually some of the reproductive cancers, cervical cancers. I mean, if you are just to look at cancer alone, you can tick off over 12 cancers that smoking causes. And this is not guesswork, this is backed by research. So, and on top of that, it actually causes a risk of stroke and hypertension. Basically, for me personally, I think that, of course, tobacco is one of the worst drugs we have. And unfortunately, it is not regulated. It is not regulated, which is quite sad. But let's move over to another silent killer, cannabis. And why I call it a silent killer is because it's almost been normalized. And the prevalence of its lifetime use is increasing. People are even cultivating nowadays in their homes. People usually have this argument that, it's natural, it's a herb. But let me tell you the problems I have with cannabis, because I have seen patients who have come in with serious effects and with less serious side effects. The less serious side effects are people who use cannabis have these symptoms called a motivation symptom. They just don't want to go to school. There's so many children who are just dropping out of high school, dropping out of uni, and what they want to do is just sit around and smoke cannabis. Okay. But the more serious side effects of cannabis, I want us to focus on this. Cannabis can actually produce psychotic features where somebody can be extremely paranoid, can start hallucinating and lose touch with reality completely. And this kind of psychosis, sometimes it can persist even when the person stops smoking cannabis. All right. But aside from this paranoia and hallucinations, of course, we can see that it causes impaired judgment, memory problems, very common, causing anxiety, depression. Basically, cannabis is not this thing that we've been thinking that it's just, a mild drug. So we are almost towards the end, and I'd like us to talk about the treatment before I take your questions, because I can see we're at 8:45. So when we're talking about treatment, number one is what I said. You have to look at the factors. What are the underlying factors? Don't just throw somebody in a rehab without looking at this person. Is there a medical issue? Because to be honest, sometimes the person has a medical issue which they don't want to deal with, so they turn to substances. For example, HIV. We've seen a lot of people who are diagnosed with HIV, and the stress of knowing that you're positive is just too much. So what do? You numb the pain with whatever substance you decide to use. So what is the problem? Is it a psychological thing? Is this person bipolar, right? Figure out the social aspect. Is this person going through a divorce? Right? Another social thing that causes a lot of addiction is retirement. People get to retirement and they don't know what to do with their lives, so they become addicted. They just start drinking more than they do. Another social thing that happens is midlife crisis. Midlife crisis, your 40th birthday is coming up. Perhaps you lost your job during the pandemic, or perhaps you just don't think you're where you should have been when you turn 40. These social things have to be investigated and addressed either in therapy or in other ways. And we also have spiritual aspects of this. Some people even reach a spiritual crisis, and we always say that we even encourage people to even seek some religious guidance if they're having a bit of a conflict and crisis in their spiritual life. The second aspect of treatment is tailor-making treatments according to individuals. So it's not a one-size-fits-all kind of thing. Some people will do well with rehab, others will not. Some people will do well with therapy, others will not. Some people will need 2 or 3 rounds of rehab. So it's guided by the person. Some people will need even family therapy, because guess what? Sometimes the family is the biggest problem and contributor. Okay? Then the last part is actually picking up on that point. The last treatment aspect is working with significant others to explore the substance use and include them in rehabilitation, because the biggest problem with addiction is that it breaks up relationships, it breaks up families. So as you're treating this patient, you're also treating the family. You need to do family therapy, you need to do marital therapy, you need to counsel the children. You even perhaps might need to include the employer and educate the employer on what this addiction is all about and how to handle an employee with addiction, because a lot of stigma comes from the workplace. So with that, I'd like to end the presentation at that point and just jump into the Q&A. I can see there are several questions here. So I'll just
Doc.
Yes, please.
Yes, thank you for the presentation. I think before we go to Q&A, we have some three persons who have raised their hands for the longest. I think it would be fair enough if we give them at least some few minutes. They just speak, if that's okay with you, so that we can start with Dorcas Kimaiyo, Winfred, and then Breda.
No problem.
Maybe we can start with Dorcas Kimaiyo. Dorcas, you're there? Or maybe Breda, I don't know.
She's
Breda
talking, but we can't hear her clearly.
Hello.
Hello, this is Brenda.
Yes, Breda, I can hear you.
Yes, thank you for the presentation. I had written my question. Mine was to find out whether there are rehabilitation centers that are for free, and if so, maybe you could please share with me the details for a few friends of mine. Then number two, you mentioned about marijuana, and you mentioned that there's you don't feel like it's actually not a good drug. I have a relative of mine who we are treating through the use of marijuana because of autism. I don't know, as medically, have people come up with a conclusion that marijuana is not proper, or is it okay to use it? Is it safe? Because I'm now worried that it might affect the child.
Okay, I got your second question, but I didn't get the first. Let me answer your second question. According to psychiatrists and mental health specialists, we've all agreed marijuana is not a good thing because of, I think I put up the slide before, it's not a good thing. I think I can safely say that there is a consensus, and there is research that has shown it causes psychosis. So for us, there's no way it can be a good thing. And even when it doesn't cause psychosis, it causes a dependence. Anything that causes a dependence, we always tend to frown on it a little bit.
Okay.
What was the first question?
My first question was, are there rehabilitation centers that are available for free where we do not need to pay?
Not that I know of.
Okay.
Yeah, because even with Madare has a rehab, it's still, I mean, you still have to pay, but I do believe NHIF pays a part of it.
Okay. Thank you.
Thank you so much, Breda. Maybe we can try Dorcas again. I don't know if she's there. Then Jackson, as we go to Q&A. Jackson Kiyo. Walter Ayero.
I hope you get me clearly.
Yes, I'm getting you, Walter. You can go ahead.
Thank you for the presentation. It was actually very informative. My question borders on alcoholism and genetics, because I think I come from a family of alcoholics and people blame it on genetics. What's the relation to that?
Thank you for the question. So we all know that our genetic structure determines our.
LP.
Somebody's talking. Please mute. Yeah. So we all know that our genetic structure determines our human traits, right? So your genes are the ones that determine your eyes are brown or blue. So if your whole family, your eyes are blue, that is because of a particular gene, right? And these genes are passed on to us by our parents. Now, these include even behavioral traits. So it's not just physical traits like the blue eyes, there are also behavioral traits that are passed on genetically. And these include the genetic predisposition to alcoholism because of the behavior. Have you ever heard of a family where everybody is just late? They all run late as a family, or a family where they all keep time, or a family where they all have a short temper, or many people have a short temper. So even behavioral traits are passed on genetically. So, but however, it's important to note that genes alone do not determine whether someone will develop alcohol use disorder. And that's why you'll find in your family, it's not everybody, it's some. This is because with alcoholism, it's not just genetic, it's genetic plus environmental factors that come together to produce alcoholism. So yes, the gene is there, but it doesn't mean even the future children who will come will be alcoholic. And that's why the environmental part, at least we can control that part. We make sure that this person is at least educated about alcoholism. So I think my advice to the rest of the family is to openly talk about it, how to prevent alcoholism, how to pick it up very early, how to learn how to cope with stress. But at the same time, I would also urge that those people who have been branded alcoholic in that family, perhaps a bigger research should be done to establish whether there are other conditions, because perhaps it is bipolar, perhaps it is something else, not just alcoholism alone. I hope I've answered your question.
Thank
Yes,
you,
you
Doc.
have.
Now we can go to Q&A.
Okay, so I think the first question in the Q&A, Doc, if I'm genetic, I think we've answered this question. It was about the genetic predisposition to alcohol and the steps one can take early to avoid losing control. I think the first step is what I talked about, where you have to look at the environment that you're in, assess your environment. You learn, I would say this person who's genetically predisposed to addiction should definitely have contact with a therapist, just to screen the person and look at their environment, look at their social situation, and assess for underlying conditions so that they don't end up there. But I think I touched on that answer in the previous question. So I'll move to Edgar Masiga's question. So a brief description of anxiolytics and some examples here, please. Anxiolytics are the medicines that we use in anxiety. There are quite many that we use, but I can classify them as short-term treatment for anxiety and long-term treatment. For short-term, we tend to use the benzodiazepines class of anxiolytics. So these ones, we only use them for a short period of time. It's recommended you don't use for longer than 6 to 8 weeks because they are addictive, and using them for longer than 6 to 8 weeks can cause a rebound anxiety. So if we're thinking long-term, we tend to use antidepressants because they also have an anxiolytic effect. Okay, I don't want to turn it into a pharmacology class, so I'll move on from that question. Movie Pavel, I won't mind having the slides sent to my email address. What I can do, I can share the slides with Justus, and then he can share with the rest of you. Yes, another request for the presentation, and there's another request for the recording. So kindly, Justus, maybe you can assist with that.
Sure, I'll do that.
All right, so we have an anonymous question. I have a friend who spends salary in drugs first, and second day of pay, all money is finished. But without money, he's always a focused person. How can we help such a person? Thank you so much for this question. It touches on finances. and how they play in with this kind of treatment. Now, there's a type of addiction. There's addiction that is fueled because of the person's financial status or somebody having problems with managing their money. Gambling is one such addiction where somebody has lost control with money. So actually, I think this particular person, their drug is money. We've all seen this kind of people who they get money and they are completely just out of order. They can't handle their affairs. They can't seem to, even some people are just perpetually in debt, yet you have a good job. You know, people don't understand where their money goes. So what I would say is in therapy, we also can do financial management, but I would recommend that this person also gets a financial coach, because sometimes it's not always just a mental problem. Sometimes you need some practical solutions, such as financial coaching. So you can recommend to your friend that he gets a financial coach and also a therapist still to look at underlying disorders. Because, for example, there's a disorder called bipolar disorder, where one of the symptoms of bipolar is having high risky behavior. So people with bipolar will do things like spend their salary in one whole weekend. People with bipolar will, gamble a lot. They tend to have problems with money. So I would say that this person also needs to see a psychiatrist just to rule out that we are not having an underlying bipolar. I hope that has come out very, very clearly. Yeah. All right. So let's move to the next question. This is from Movie Patel. When I take a glass of whiskey daily, is that being addictive? Before I even talk about the recommended units of alcohol, I'd like to say that the best way to know is try and not take it once in a while, because now you're taking it daily. Try and not take it. If you notice some of the things that we talked about, especially that feeling of uneasiness when you don't take it, then you'll start feeling like, okay, that is a bit problematic. So if anybody here who uses any kind of substances, please, I recommend regular fasts. Just say that this month I'm not drinking, okay? This month I'm not drinking. Let me see how it goes, especially with alcohol, because as we said, it's become very normalized. It's become very, very normalized. So challenge yourself once in a while. Say this weekend I'm not going to drink, and see how it goes. If you start noticing that you're irritable, your body is almost telling you just do it. If you notice you're struggling to stop even for a weekend, that's problematic. But to be more objective, it is recommended to drink not more than 14 units of alcohol a week. And this should be spread across 3 days or more. So you don't take the 14 units on one day. That one is still problematic. So the 14 units should be spread around 3 days or more. So this means it's around 6 glasses of wine a week, or 6 pints of beer a week, not on the same day. Are we together? Not on the same day. And then when it comes to, stronger things like units, it should not be more than, I think it says 7 a week. Yeah, 6 a week still. 6 a week, 6 units a week. So people have always challenged us with this units thing. But for me, I would always just say it's about how much you need this alcohol. Like without these 6 units, will you be angry at everybody? You're not focusing, you're not, you're all over the place. Because you can be sticking to that 6 units, but it's messing up everything for you. That's still very problematic. All right, so let me answer Moses's question, because we should almost be wrapping up. Is there a hereditary link to addictions of all kinds? Yes, addiction is in general, as we've said, we inherit the genetic traits for addiction. So yes, there are people who are more predisposed to addiction than others. All right, an anonymous question. Good morning. Why is it that every time I take alcohol, mostly beers, I get stomach ache and sometimes running stomach? My answer is I don't know, but please go and see a professional to do some assessments and tests. Okay, so I can't make a diagnosis, but definitely there is something there that requires investigation. Huh? Somebody has asked me to return to the slide of effects of weed use. Let me just go back to that. I mean, I can just share the slides and you can talk more, but let me go back to that. Right, so you can have a brief look at it. We talked about marijuana releases dopamine. Of course, this is where people get the munchies. They want to eat and drink more than usual. It can make depression worse. So even if you had a little bit of mild depression, it can make it worse. It causes anxiety, and this is because marijuana is known to produce a lot of paranoia. So you start just feeling like something is going to go wrong. So it causes a lot of anxiety. It causes short-term and memory problems, impaired judgment, delayed reactions, and this can be very dangerous if you're driving or doing anything like work. If you're having a delayed reaction, this can put you at risk. And the most serious symptom I had talked about is the psychotic symptoms, especially hallucinations, where you start hearing people talking to you who are not there or seeing things. Yeah. I want to look at this comment because I find it very significant. Eliud Maina, you said that my name is Eliud, a recovering addict and working with NACADA. My question is on brain damage by alcoholism. If one stops taking alcohol and embraces sobriety, is this condition reversible and one gains the full brain health again? Thank you for this comment. I wouldn't even call it brain damage. Brain damage is very, very extreme. Brain damage is permanent. But the changes we see with alcoholism, like for example, brain atrophy, I wouldn't say they're reversible, but I would say that brain cells can regenerate. So I wouldn't say the brain will now go back to its normal size, but some of the neuronal pathways can regenerate. So the answer is yes and no. So if you stop drinking, there will be some slight improvement, definitely. You won't be having this, some of the cognitive problems like attention, concentration, memory problems. But when we look at the MRI, the brain will still have some of those changes. So Jimmy Mukoka, you say, thank you for the presentation. There is a name the presenter used on cannabis and tobacco as the drugs from which people with opioid use disorders graduate from. I really didn't get it clear. I talked about gateway drugs. Cannabis and tobacco are great gateway drugs, like open the gate kind of thing, gateway drugs. All right, an anonymous question. What about other forms of addiction like sports gambling, which has caused a lot of havoc among our young population? They need to be addressed too. Yes, they do need to be addressed. They are very important. Maybe we can do another session on the same, but I agree with you. There are very many forms of addiction. We have gambling, we have pornography addiction. There are very many. There's even food addiction. So perhaps we can organize for another session, or I can share some reading material on the same. But the interesting thing is that sometimes you can have even 2 or 3 addictions. You can find somebody is addicted to alcohol, cigarettes, marijuana, gambling, and pornography. So it's very possible that somebody can be addicted to more than one thing. Okay. Gitonga, you say, with the emergence of substandard and cheap liquor in our market, these products are enriched with other socially unacceptable substances like bang and cocaine. Do their clinical management change? So I had no idea that liquor is being put bang and cocaine. Rather, I can't say with confidence, but if that is happening, definitely it will be addressed, because when we have an addict coming to the hospital, for example, in Chiromo, we usually do a drug screen. So we assess everything that is in your system. So even if, what I know for a fact is that some of the cannabis that is in the market is being laced up with heroin, with even pharmaceutical drugs like morphine. We are seeing these things. So what we do, we always start with a drug screen so that we manage whatever we find in the toxicologist screen, and not just what somebody is telling us, because it is true that people lace drugs with other things. That is very, very true. But I think I'm hearing this for the first time, that liquor is being put cocaine. It's very, very interesting. But I think the take home here is for us as people in the society, if somebody has a problem, the thing is just to get them help. And especially the help should start with them having an admission in hospital, where we can do a detox and assess for everything. Yeah, because usually the problem is people just lock people up in a rehab for 3 months, and thorough investigation and assessment is not done. So you'll never know if this person had a cross-contamination of their whatever they're drinking or anything. So the take home is, kindly please take measures to get people the correct help they need. So Ruth is saying, my own is totally addictive and he develops hand irritating, means the skin start peeling off like bacteria thing. Shaking, sweating, weird dreams. He has tried all means to change, but in vain. All this can't mention. Ruth, I think perhaps you need to bring the patient into Chiromo for some assessment, because I think this one is a personal question, which of course I've not assessed the patient, and he would need a proper assessment to figure out what the skin rash is, and yeah, to get him the help that he needs. So kindly, we have our branches, 2 in Westlands and 2 in Lavington, and even 1 in Nyali. So this one sounds a bit urgent. You can bring him in for that kind of help. Okay, there's this question about the pints, the alcohol units. I had said that we advised not to drink more than 14 units, and somebody wants to break down what a unit is. So a single small shot of a spirit is 1 unit. A small glass of wine is around 1.5 units. A beer is 1 unit. I think that breaks it down. Okay. And I think the point we said is that those units need to spread over 3 or more days. So you're drinking the 14 over 3 days. And then it's also recommended with this unit calculation that you have several drink-free days each week. Sawa. So another question, and I think I'll take only these ones that are here, because of time, I have to start my clinic. So Francis, you ask, if someone cannot stay without tea or without tea gets irritable headache, is that classified as addiction? I would say that's more of a dependence. I think we went through all the stages. So that's a dependence. It's not yet at an addiction. Okay, anonymous attendee, I'm a social drinker of Muratina. In 2016, I took Muratina occasionally, like every 2 weekends. Going by my health records, I did not get the normal common colds, homa, etc. for the whole year. Now that there is this homa in Nairobi, should I try that trick again? After Corona period, we have normalized common colds reoccurring every 1 to 2 months. I don't know about Muratina, to be very honest, and especially I don't know whether it can prevent colds, but it is an alcoholic drink. And for me, I would say that if you're looking for something to prevent your cold and flu, we have other things like vitamin C supplements, actually taking fruits. We have a natural supplement called CMOS, which you can try and take. I mean, why would you set yourself up to become dependent on this Muratina in the name of it's helping me prevent colds? Because what if a year or two from now, you now can't live with that Muratina? So usually, I mean, if you don't have to use alcohol, please don't set yourself up for an addiction saying that it helps me do this or that. Usually we see this common thing, people say that I just drink 1 glass of wine at night or one double of whiskey to sleep. You know, a year or 2 or 3 from now, you won't be able to sleep without that thing. So now you're setting yourself up for addiction. You know, so if you can just try the other natural remedies. And to be honest, no, I mean, it's a cold. I mean, even if you get it, we've all recovered from colds. So, I mean, I think look at the benefit versus the risk. I don't think it's worth taking that risk, in my opinion. So kindly tell me the relationship between alcohol and migraine headache. It's one of the withdrawal symptoms of alcohol withdrawal. So, and it's related to after drinking alcohol, people tend to feel a bit dehydrated and the sugar drops. And these are the causes of the migraine headache. Yeah, so it's during the withdrawal period that people will get that very bad headache. Philip Idewa, is there a plan by the government to construct more rehabilitation centers in all the counties? Not that I know of, but I think this is where social advocacy needs to come from. Usually, you know, the government doesn't do things because they want to do them. Usually they do things when the Kenyans demand for services. So actually this is your task, Philip. It's not my task as a doctor or as a psychiatrist. It's for us to demand these services from the government. It's for us to speak up and demand for these services. But of note is that after the mental health task force, there's going to be a construction of a new mental health hospital in Ngong to supplement Mathare Hospital. So at least that's one of the recommendations of the task force. That one at least I can say confidently, but I don't know any other plans of the government. Hopefully they will. Hopefully they will. Anonymous question. I have a relative who becomes paralyzed from the neck down after alcohol consumption, and he can be in this state for up to 7 hours. What can be the problem? That is withdrawal. And it's called a stupor. So yes, it is completely possible. So actually, remember we talked about the withdrawal period being very dangerous. So you can have people convulsing. They can even now get those kind of things. And this is actually quite dangerous. This person needs medical attention. So my name is Moses, and I'm addicted to tobacco, which I sniff via nose. Kindly assist how I can emerge from this. Thank you for sharing that with us. I know it's not difficult to share, even if you're sharing anonymously. You know, this kind of addiction already has become a physical where you need this thing. So what I'd recommend, please come in. Our doors are always open because it will require a lot. It will require a lot. It will require a lot of some medication, some assessments, some therapy. So this is not something that is just can be fixed in one day, but there are treatments for tobacco withdrawal. There are even medication that we can use to suppress some of the cravings. So please come in for an assessment. So does there exist a nexus between drug abuse and diabetes? I'm not very sure about a connection between the two, but what I can say is that drug abuse can cause diabetes. Remember we had said earlier that, maybe I can go back to that slide. The slide which had the tobacco, the systems that tobacco affects. You see this? Tobacco affects the pancreatic metabolism and can produce diabetes. Alcohol itself can also cause a problem with the metabolism through insulin resistance. So yes, drug abuse can cause diabetes. And also the reverse can be true. Diabetes can also produce drug abuse because, when you have a chronic condition, people might start to feel like it's very frustrating dealing with that condition. So they can turn to substances to be able to cope. So I guess in a sense, there is that kind of a connection. So Joseph, you say we are faced with alcohol, and I'm going quickly also because of time. So kindly, I would avoid anybody adding questions because I'm completely out of time for now. So Joseph, we are faced with alcoholism, bang usage in our area, which is really affecting the young generation. They seem to be minimal controls, and it is really worrying on how the next generation will be. In the current life, every woman for himself or every man for himself, and you can't try controlling other people's life. Otherwise, if you try, you may end up on your own. What can be done in such a community? The trend is worrying. I think the question is to you, Joseph. Sometimes, thank you for expressing the problem so well. And I think the mirror problem is, the mirror and bank problem is very rampant. That I agree with you. But the answers don't even come from us. The answers come from you, the people in the community. What can you do about it? What can you do it in your family? What can you do about it in your estates? Right? Because sometimes the solutions also come from us and not necessarily from even the government. Sometimes it comes for us to do outreach programs through the church, do outreach programs in the estates, right? So let's also take this as our own personal problem and come up with the solutions ourselves. Yes, Jimmy, you say that substance use disorders and mental disorders are co-occurring. One can lead to the other and vice versa. Very, very true. Does shaking go away? Yes, it does when it's managed very, very well. But there are some kinds of shaking, the tremors seen in chronic alcohol use that doesn't go away. So it's a 50-50. It can or it may not. Predator energy drink, is it an alcoholic product? I don't know. No idea. But these alcoholic these energy drinks tend to have caffeine, taurine, and sugar. So the addiction to them most of the time comes from the caffeine and from the sugar itself. But I haven't heard of Predator drink myself. Perhaps I'll check on it. I have a relative who only drinks alcohol when he has money and tends to use all his money on alcohol. How can we help him to stop drinking? Again, if you know anybody who is struggling with an alcohol problem, even if it's related to money or what, this person needs to be brought to a facility, a specialized mental health facility where assessments will be done. And remember, we said we do tailor-made treatments for every patient. That's what needs to happen to this relative. Okay. Then the last question, Maurice, very informative presentation. I'm a beneficiary of Chiromo, very professional. My regards to Dr. Oiroto. I'll pass on the regards, and that for me will be the last question that I'll take. Everybody is requesting for the slides. We'll share them kindly. We will share them kindly. So thank you so much for having me. I'll pass it over to Justice. Thank you so much.
Thank you so much, Dr. Vundi. Maybe the last one, because questions are many, and we of course, I'll share with you. Once you respond, I'll share with our audience. So an anonymous attendee is asking, is workaholics an addiction, and how can one be assisted?
Yes, it is an addiction. Yes, it definitely is an addiction. I think for me, I think the take home is this: any addiction, we talked about all these substances. Then somebody even in the questions had asked about gambling addiction. I had talked about pornography and food addiction. And then now this anonymous is bringing up workaholism. Anything that is an addiction. The treatment guidelines are the same. And let me move over to the treatment guidelines. This is the treatment guideline for any addiction. We'll start by establishing what is the cause. Yeah. Are there medical issues? Are there psychological issues, depression, anxiety, anything? Are there social issues? The ones we talked about, divorce, retirement. A social issue can be, for workaholism, can be, whereby you come from a family that completely depends on you, so you end up becoming a workaholic. And even spiritual issues. So any kind of addiction, you have to establish the factors. Then we design a tailor-made treatment plan for whatever the addiction is. And then you work with the significant others, family members, the boss, the friends. Sometimes we even bring in, like for example, if you're divorced, sometimes in therapy, we'll bring in even your ex-wife just to get a picture of why is this person having this issue. So to answer the question, definitely workaholism is an addiction. Some people are even addicted to shopping. So there are very, very, very many types of addiction, but they all follow this. For us, we manage it in this particular manner.
Thank you so much, Daktari, for taking time to elaborate on that. So, and even our audience. So at this juncture, I'll give my colleague Sadra to give a vote of thanks.
My name is Sandra from APA Medical Department. Thank you everyone for creating time to join this webinar. And we've seen so many people have joined from different areas, and even with the engagement that we've had, it shows that everyone was very keen on the presentation. And we thank you so much for that. We normally have webinars every last Friday of the month, so you can feel free to join. We will be sharing, and so that we're able to keep learning and keep getting ideas on how to get out of some issues that we might be having and we have not been able to address. Thank you so much, Dr. Caroline Vundi, for such a very, very informative presentation. I know we still have so many questions. Everyone listening has questions and things that they would like to clarify, but time is not on our side. We will create at least time for a response for that. In case anyone has any question or they need to get the slides or the recording, kindly just write an email to us on cdm.wellness@apinsurance.org. I will repeat, cdm.wellness@apinsurance.org. If you have any query, we will be able to reach out to Dr. Vundi to respond to you. And if you need the recordings and also the slides, we will be able to share to you. We also thank AP Insurance for giving us this great opportunity and organizing this chance for us to have the webinar in place. We know without them, we would not be able to hold such a webinar for our clients and ourselves. So we really, really thank AP Insurance for that opportunity. And we also thank Chiromo Hospital Group for also taking the opportunity to take us through this and for giving Dr. Vundi that chance to take time off her duties just to speak to our audience and to us. We are really, really grateful. So in case anyone would like to see Dr. Vundi or to get services from Chiromo Hospital, they have 5 branches, 2 in Westlands, 2 in Lavington, and there's a new one which has just opened in Mombasa. So feel free to visit the facility at any given time and raise your questions or get assistance. Like for the 2 people who had clients or who had dependents who have the issues that they need to be addressed, kindly just visit the facility and you will be assisted and you'll be guided on the same. So thank you so much. Have a good day. And in case of anything, just reach out to us. Have a good day and just ensure that in case you have any issues, be getting in touch with for assistance before time goes so much. Thank you.